Let's get more on our top story, the Sydney COVID outbreak. As we've mentioned, tightened restrictions came into force late yesterday, but will they be enough to contain the spread of the Delta strain? New South Wales Health Minister Brad Hazzard joins us now. Good morning, Minister. Look, we were going to have a camera across you, but we've had some last-minute changes of plans. We've got you on the phone. We appreciate your availability, but can you let us know what's happening here?
You mean in relation to me personally, Lisa?
Look, if you don't mind, because this has all happened in the last 5 minutes, I'm a bit curious why all the plans have changed.
Look, I guess it emphasises how dangerous this Delta virus is. I received, during the night, I was due to do a range of TV interviews this morning, you included, and I was advised when I woke up at about 5:30, there was a text message that had come in sometime during the night. And to be honest, I haven't worked that out yet, telling me that a case had been detected as a likely positive and that I was a possible close contact. It's still being worked through, and Health asked me to obviously be cautious until Health were able to give me further advice. So, yeah, I think it's a message to everybody at the New South Wales Health Minister can get a text message during the night and wakes up to that, then obviously we all have a serious issue at the moment with this Delta virus.
Yes.
And so I'm unable, and I apologise to you and to your viewers that I just couldn't do it at this stage. But look, I'm available to talk and not suffering any symptoms, so I just want to stress that it was to do with my workplace, obviously, New South Wales Parliament, and the location and details will be no doubt worked on by New South Wales Health this morning, but I'm quite confident that the majority of people in the New South Wales Parliament will be either no contact or casual contact, so that won't be a major issue. But certainly from my point of view, I was identified as a possible close contact, and I believe that was after an interview that occurred with a person who may be positive, and they're just working through those issues.
So you mean when you say an interview with someone that another journalist interviewed you and that might be the positive case?
No, not talking about a journalist. I'm talking about somebody who works in New South Wales Parliament who may be a positive case. I think that from what I understood, what I understand is that they're working through those issues. They're having further discussions as they do on these issues, but in the meantime, I've been advised that I may be a close contact. So they've got to ascertain and confirm with the usual scientific requirements that the case is actually a positive case. But in the meantime, obviously they've interviewed that person, and that person has identified me as having been possibly close to that person, and that person therefore has now caused, we'll draw that, I don't mean that person has caused because it could happen to anybody. That situation has now caused me to have to be exercising extreme caution.
Right. Well, we've got a health minister in isolation in a state on a cliff edge at the moment. What's going to determine whether there needs to be a lockdown in Sydney?
Look, the measures that we've taken yesterday are proportionate, but I just remind your viewers that, of course, we announced yesterday at 11 o'clock, we'd had 10 cases to 8 p.m. the night before. And I'm just trying to think how many. I think it was 13 cases that we announced. 16
reported yesterday, three that we knew about the night before. Are we expecting more cases today? Clearly
yes.
There are. But,
yes.
What should Sydney-siders be bracing for with those numbers?
I think Sydney-siders should just be aware of the fact that this is a very dangerous variant of the virus. It is very, very transmissible. It tends to get over. Look, I said on, I think it was Saturday, I didn't realise just how close it would come, but I did say it was a near and present danger on Saturday, and I think now we have obviously a clear danger, and I think I used those words as well.
So we're just
now I'm on the receiving end. So
So 16 cases yesterday. Will there be more today? You would have been given a heads up of what's been.
There will be. There will be more cases today, but those are
more than 16. More than 16.
Look, I'm not going to specify the numbers at this point. That's something we do at 11 o'clock this morning, although I may not be doing it. We'll see how we go this morning. But the issue is for all of us that we must follow these new orders that have been made. And I'll just stress to people that Those include we're limiting guests to our homes, no more than 5 guests. Obviously, masks are compulsory in all indoor non-residential settings, so you don't have to wear a mask in your own home.
And Minister, to save you going through those things, because we are really pushing that message as well this morning with our reporters, and we're really letting people know. While I've got you, I'd rather get to sort of the nuts and bolts of the policy decisions. How likely is it that Sydney will have to go into a lockdown?
Oh, look, I think I don't believe that we will go into lockdown. I've made that point. I saw some journalists saying that last night, but that's the journalists drawing their own conclusions, which is not helpful. I think that we need to actually take health advice. And the health advice is that the new orders that came into play yesterday afternoon are proportionate to our risk. But people do need to be extremely cautious. People need to understand that this particular variant is quite capable of it's a very active virus, and we need to be understanding that and follow the orders.
So what do you say to the WA Premier who's urging you to crush and kill this virus? He wants to see a lockdown, says that this light touch that New South Wales talks about is endangering the nation.
Look, Mr McGowan is prone to an interesting use of language and giving advice when I don't think that's necessarily helpful. He knows nothing about what's happening in New South Wales. I don't intend to comment on him. I've avoided commenting on him for 15 months. I think we'll just leave it at that. We've managed, our community have been fantastic here in New South Wales. They have responded each time to each of the messages. We've had a very successful balance here in New South Wales of keeping our economy open. Our economy leads the country. That's very important for mental health and obviously for more broadly our health. And each of the decisions we've taken have always been based on health advice. And the health advice is very clear. These are the current requirements, and they've been put into health orders, but it's not so much the order itself. It's just asking the community to be with us on the journey, as they have been all the way along the line. I think that we will get through this, but we just need to make sure that we try and limit our interactions. We don't move around. We've made the point that in the 7 local government areas of City of Sydney, Waverley, Randwick, Canada Bay, Inner West, Bayside, Woollahra, they must not travel outside Sydney unless it's absolutely critical. So I think we've done all that's necessary. We'll handle it the same careful, calm way that we've handled it right through this pandemic. But we don't need advice from somebody who has basically one road across the Nullarbor that he closed at a moment's notice. So we'll work without that, the assistance of Mr McGowan.
Brad Hazzard, appreciate your time. Good luck with it today. Clearly a difficult situation for you trying to manage this while you're in isolation now. So thanks.
It's a little challenging, Lisa, a little challenging.
Yeah,
but we'll
I bet.
Get through it.
We really appreciate you coming on anyway.
Okay, Lisa, thanks.